Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest, Carrie Raz. Good to have you this morning.
Thank you. Good to be here.
And your company is Automoke Hearing and Balance, so we're going to talk about hearing today. We're actually going to talk about your hearing and your brain health. And so, because that's interesting that the two things would be together, I guess. And so we'll have fun with this. So I know a lot of people get hearing loss as they age. And so what's at risk with untreated hearing loss?
Sure. So hearing is really, how you hear is really with your brain. The ear is just a tool to get the information to your brain. And what happens over time is hearing loss, as it goes down, that processing is affected. So essentially your brain, once you can't hear, will rewire itself to find information in other methods. I like to tell my patients that, generally speaking, it's kind of like they're always playing Wheel of Fortune. They're missing bits and pieces. Sometimes they get the puzzle quick and easy. Other times they're trying to rely on other things like context clues. So that's kind of the connection between hearing and cognitive issues. Because if you can't hear it, you're going to find other methods to piece it together. And the worse the hearing loss gets, the harder it is for your brain to piece it together.
Well, I would always heard that, as your hearing goes, your other senses become more pronounced. So to kind of compensate for having the hearing loss. But is there a connection of hearing loss and dementia?
Yes, ma'am. So they're not directly, one doesn't cause the other, but if you have one, you're more likely to have the other. Because what happens, as I said, the brain is processing. And if your brain and vision, for example, go down, that processing gets more difficult. There was a recent study showing how your brain works when it comes to when you hear something, the parts of your brain that reacts to sound. And it was pretty much your whole brain over time. The way when you hear it, it reacts. The way your brain processes it, it reacts in a different section. So hearing is much more complicated than what most people think, because most people, when they hear that hearing and cognitive issues are related, it doesn't really make sense until you think about it a little bit and think about how it's all working together.
So, I understand, but it seems like I didn't make the connection initially. So that's good information, because I wouldn't have thought to make that connection. So I'm assuming other listeners as well. So hopefully by knowing that, it helps people that get their loved ones treated faster.
Correct. A lot of people think that hearing loss is something, I'll just do that later. I'll do that later. It really is one of those things that the sooner you treat it, the better you're going to do in the long run. The sooner you keep that nerve and that brain pathway activated, the better you're going to do. I kind of like to describe that nerve pathway like a broken down highway. So if you imagine a very busy highway, the system's going to stay strong, potholes are going to be filled, there's going to be maintenance on the highway. If you don't maintain that highway, more potholes are going to happen. There's going to be more issues with the road. So the sooner the more you maintain that highway by treating the hearing loss, the less the issues are going to interfere in the long run.
That's a great analogy. But a lot of people put off, something about hearing, because hearing aids are not real cheap.
They are expensive, unfortunately. There's a lot that goes into hearing aids, and the way the world has been set up, years ago, they were defined as cosmetic instead of being medical. So hearing aids, the price of the hearing aids, generally speaking, includes more than just the devices themselves. So it typically is the hearing aids, the processor, the follow-up, the fitting, the testing, kind of all bundled into one package. So they are pricey, and a lot of people resist because they're expensive, but it's an investment in the quality of life for the years that they last.
Yep, that's good. And so what about Medicare? Does Medicare pay for hearing aids?
Medicare does not pay for hearing aids currently. They, as I mentioned before, they label it as cosmetic. So currently, anything hearing aid related is going to be denied by Medicare. They cover diagnostics, so testing and things to see if you have a hearing loss, but anything regarding hearing aids is going to be denied by Medicare.
And you think it's because of the classification? Is that the reason that they don't pay?
As far as I know, yes. At least all the research I've done, the classification. It's something as audiologists we are trying to fight with the political system to get it covered. Because I came in the industry to help people. So any way to help get hearing loss treated more is something we as audiologists are trying to fight for. But as we all know, politics takes a while.
Yes, most definitely. And in this day and age, they can't agree on anything, so it's going to take longer probably. And so, tell our listeners what an audiologist does.
Okay, so an audiologist is a doctorate level, kind of like an optometrist. So I am trained to test, diagnose, and treat anything between your ears. So hearing loss, balance, anything related to those two things, really. So I have the training and the knowledge to treat your ear. Mostly what I do is hearing aids, but the whole inner ear system.
But what's a hearing aid dispenser?
So a hearing aid dispenser is someone who generally has a 6 months training, maybe a little bit more. They are trained to fit and dispense hearing aids. So they don't have the same amount of training as an audiologist or the same knowledge. They could be great at their job, or they could kind of just sell hearing aids. You got to weed out the people and figure out if they're good at what they do or not. Generally speaking, it's safer to go to an audiologist than a dispenser because we have the 8 years medical training.
Yes, that's always good. Well, I think you should always go to an expert.
I agree. Yeah.
When you're taking care of yourself, you should always go to an expert.
I agree.
But, they now have more of, over-the-counter type hearing aids. And so how are they different between, what you would give them as a doctor? How are they different?
It's a good question. The over-the-counter hearing aids generally are amplifiers. So they're going to make things louder, but they're not necessarily treating the hearing loss. I'm big on analogies, if you probably figured out, but best comparison is like reading glasses versus prescription glasses. They help, they make things louder, but they're not really set to any prescription or treating the problem. They're much more affordable. So if budget is a concern, they are an option, but they aren't treating the initial problem. So they do not necessarily the best case for many, many patients.
What do you find is the most common reason that people have hearing loss?
There are many factors that go into hearing loss. Genetics, noise exposure, age, all kind of play a factor, or other medical concerns. Like a lot of patients who have heart problems have hearing loss. Diabetes are more likely to have hearing loss. Kidney disease are more likely to have hearing loss. So it kind of is more of a lot of factors. There's not really one defining, yes, it's because of genetics. It usually is a handful of things working together. Hearing loss affects every age. It's just a matter of when it's going to affect you.
No, don't tell me that.
If it makes you feel any better, I personally wear hearing aids. So,
well, you're very young, and did you become an audiologist because of your personal hearing loss, or did it just coincidence that you're an audiologist and you have hearing aids?
A little bit of both. So I didn't wear hearing aids until I was an audiologist, but I grew up with ear infections as a kid. So I was one of those in and out of the doctor's office, the tubes, all of that. That was my childhood. I, in college, realized that I had tinnitus. It was something I've lived with forever. So my ears ring 24/7. And then when I graduated and started working with hearing aids, I knew I wanted to work with or wear them. Because if I'm going to put them on my patients, I'm going to wear it myself, and then realize they benefited me. So I've worn them every day for 5 years now.
Good. That's great. And so tell our listeners why it matters of where you get your treatment for hearing loss from, rather than just go to Costco or Sam's or something like that.
Yep. So getting hearing aids, the amount of money you spend isn't really the what matters. The hearing aids, any hearing aid, you can get the top of the line, most expensive hearing aids, but if they're programmed poorly, they're not really going to benefit you. So they are only really as good as they are programmed. So going Costco or Sam's Club, it's a great budget option. They are different hearing aids. So what I have versus what Costco or Sam's Club or whoever has, they look similar, but the computer or the actual device is different. But the biggest difference is how they're programmed. Having the knowledge and the ability to fix anything that's complicated. That's kind of my personal passion, and what I'm good at is finding the solution to the complicated cases.
So if you have someone that says, I've tried different hearing aids and they don't work,
Mm-hmm.
that's the person you want to see, right?
Yes.
That one?
Yes. Oftentimes those people had one bad experience and then went to get an amplifier, went to find the cheaper price because they went the expensive route and it was a bad experience. So unfortunately that happens often. But I have always taken pride in finding the right solution for my patient rather than trying to fit you in something, sell the hearing aids. I've always found my job is to be, I'm a problem solver. So I'm going to find the right solution for that patient.
Yeah. I always thought it was just he didn't want to listen to anybody.
That's possible too.
It was more a guy thing.
That happens a lot as well.
Definitely. So Carrie, you're close to my office, so which is really, really exciting. So how does someone get a hold of you if they want to come in for an appointment?
Sure. I work at Autumn Oak Speech and Hearing. It's in Friendswood, Texas. Let me get the phone number for you. The best way is to call us. So 281-816-3067. We are open 9 to 4 every weekday.
And can you tell our listeners the website?
Yes, it is speechhearingtherapy.com.
And is there a particular email as well?
The best one is support@speechhearingtherapy.com.
Perfect. And so we want to make sure that the people that are listening get the same good information as well. And I appreciate you being on and drop your stuff off because I have somebody I can send you your way already. and definitely to hopefully, give you an opportunity to help more people. And so, and I appreciate you being on the show today.
Oh, thank you, Kim.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.